Hello, Dimsdale. I'm Jet You Betcha with today's editorial, which technically makes it a Jetatorial.
As Arctic sea ice melts, ship traffic in waters north of the 60th parallel has surged, increasing 37% from 2013 to 2023, while total distance traveled rose 111%. The rise in activity has boosted emissions of black carbon, or soot, which accelerates warming by darkening ice and reducing its reflectivity. Emissions grew from 2,696 metric tons in 2019 to 3,310 in 2024, with fishing vessels the largest source. Several countries have proposed that ships use cleaner polar fuels, though progress at the International Maritime Organization faces political and industry resistance. A 2024 heavy fuel oil ban includes loopholes limiting its impact. Some shipping companies have pledged to avoid Arctic routes, but economic incentives continue to drive traffic northward. In other developments, Saudi Arabia has reintroduced the critically endangered red-necked ostrich to the Prince Mohammed bin Salman Royal Reserve, marking its return to the Arabian Peninsula after a 100-year absence. The species, closely related to the extinct Arabian ostrich, was selected under the Rewild Arabia program for its ability to survive harsh desert conditions. 5 birds were released into the 6-million-acre reserve as part of a broader effort to restore 23 native megafauna species, including leopards and cheetahs. About 1,000 red-necked ostriches remain globally. Officials say the birds will support ecosystem recovery through seed dispersal, soil aeration, and nutrient cycling. The reserve has also reintroduced other species, such as the Persian onager, in recent years. In another update, the Food and Drug Administration has begun steps toward potentially banning butylated hydroxyanisole, BHA, a preservative used for decades to prevent fats and oils in processed foods from spoiling. BHA, approved in 1961 and previously classified as generally recognized as safe, is found in products such as frozen meals, cereals, cookies, ice cream, and some meats. The agency is launching a new safety review and requesting data from the public and industry on its current uses and risks. In the 1990s, the National Toxicology Program listed BHA as reasonably anticipated to be a human carcinogen based on animal studies, though human research is limited. The review aligns with broader federal efforts to reassess food additives. Some public health experts welcome the move, while industry groups have not yet commented. In other developments, contract battles between hospitals and insurers are increasingly spilling into public view, sometimes leaving patients uncertain about access to care. In New York City, a dispute between Mount Sinai Health System and Anthem Blue Cross Blue Shield has put some treatments at risk after physicians went out of network January 1st, with hospitals set to follow on March 1st if no deal is reached. Mount Sinai says Anthem owes $450 million in unpaid claims, while Anthem says the hospital is seeking steep rate hikes. Researchers estimate 500 to 600 such public disputes occur annually, driven by rising hospital costs, insurer pushback, and new pricing transparency rules. Experts say patients can face delays, higher costs, or provider changes when negotiations stall.
From all of us here, stay classy, Dimsdale.